Hello everyone. Today let's see what should we do once we know that our child is coming under the category of autism spectrum disorders. So first and foremost important thing is to understand the baseline of our child, as all the therapies needs to be tailor made according to your child's specific needs, according to his positives, according to his limitations. So generally at Daffodils, when we have to start suggesting and thinking about the therapist, first what we do is we try to get a baseline of the child. When we mean by baseline, I want to really understand the strengths and weaknesses of the child in three different areas. One is your social communication, the child's behavior, and then the sensory aspect of the child. So depending on the issues, depending on the things which we need to concentrate in therapies, as psychologist, speech pathologist, occupational therapist will sit together along with the parent, and then we decide what exactly we need to do now. So the roadmap or the therapies of an autistic child depends on this extensive discussions on the extensive baselines. So for example, there could be children who might have a lot of repetitive behaviors or a lot of hand flapping issues, or there could be a children who needs to run away most of the time, which shows that their attention is getting affected and sitting tolerance is getting affected. So primarily I would suggest our team of therapists and the parents to focus more on the behavioral part of it and on the sensory integration for the child. And then once we get the child to sit down at one place, at least settled for 5 minutes of duration, then we'll start focusing more on our speech. So generally at Daffodil CDC, for the children who comes under the spectrum, we suggest integrated therapies. Integrated therapies is nothing but the child would be undergoing an intensive approach to the therapy, keeping three professionals in mind. Your behaviorist, your sensory therapist and the speech pathologist are going to work combinedly in order to target the specific needs of the child. As we always say, the therapies needs to be tailor-made for every child based on his strengths and the weaknesses. There is no one specific therapy approach which will suit all the children just that they are labeled under ASD category. So your team approach, your parental knowledge and the child's behavior is all plays a very important role before choosing the therapy. Thank you so much.